You can begin your dissection of the face, and we've already done some of this. We've cut along the lines that have been illustrated in your course book, and just wanted to point out a few things here. The first thing you should do is to put a new scalpel blade on your scalpel, because you will need a good sharp scalpel to do this portion of the dissection. Now, the thickness of the skin is going to change to some degree by the amount of fat on the body. And you can see we've left some of the fat at various portions here so that you can see the change in coloration from the fat, which I have right here, and then you're going to be cutting away thin layers until you come down to a change in coloration to this light brown, which is the musculature. And here we still have a tab of skin left, so that you can see that as you cut down, you want to do it in thin layers until you can see that change in coloration. And when you do so, try to stay in that plane, because those will be your muscles of facial expression. So after you've removed the skin from the majority of the face, you will be able to identify these muscles. And we only ask you to identify a few of them, and those are the ones, of course, around the mouth, the orbicularis oris, and around the eye, the orbicularis oculi, some of the more important of the muscles of facial expression. And then coursing down in the neck will be a very thin muscle which extends over most of the front and lateral side of the neck, and this would be the platysma coming down here. And as you can see, this is a very, very thin sheet-like muscle. So once again, you're going to be dissecting down to look for that coloration of the muscle fibers. In some cases, you'll go in and out of the plane. I think that you'll, in your dissection, if you're careful enough, you'll see enough of these muscles to get the idea of how they run. After you've done that, on the lateral side of the face, as you're doing your dissection here, again, it's a change in color, so that we have some of the fat, which is bright yellow here, and up in here. And in this region on the lateral side, you can palpate, it'll be beneath the zygomatic arch, and in front of the auricle here is going to be the area where we have the parotid gland. And once again, this is a gland that looks somewhat like the pancreas in the sense that it's slightly granular, and it will be extending on this whole side of the face beneath the zygomatic. Now, as you go anteriorly, there will be a fairly sharp border right here, which is the border of the masseter muscle, which you can see right here. And you should palpate that on yourself when you clench your jaw. You can feel that very sharp border. And extending from the parotid gland right here, there will be the parotid duct, which I can just illustrate here. And it extends forward. There's going to be a pad of fat right in here. And you want to carefully dissect away, using a pair of forceps, this pad of fat, which would be just anterior to the masseter muscle, and you can actually follow the duct of the parotid gland going anteriorly. And when you dissect in this region, what you will find will be a fairly substantial vein, which I have right here, and an artery which lies next to it. And our artery has actually been cut during our dissection, and that frequently will happen. But we'll have the facial artery and vein which runs in this pad of fat. Now, after you've dissected this pad of fat out a little bit, and you've cleaned up the duct of the parotid gland, we will start to look for some of the branches of the facial nerve. Now, the facial nerve is very difficult to find because it runs through the substance of the parotid gland. And one of the easiest ways of finding it is that after you've isolated the parotid gland, you can look a little bit superior to it, and there should be a nice thick strand of tissue, and that's one of the branches, that's the buccal branch of the facial nerve. And as you travel or follow the branch of the facial nerve, it will disappear within the substance of the parotid gland. But by following this back, you'll achieve a plane so that you'll be able to cleave the parotid gland so that you'll be able to follow this branch posteriorly. So here's the whole branch right here, and it's going posteriorly, and it will become thicker, and you'll see multiple branches coming off of it, and you'll learn the names of all of these branches right here. So here's one coming up towards the zygomatic area, and follow that back until you find the main stem of the facial nerve. And we've done that, and as we've followed this plane back now, I'm able to illustrate here the main trunk of the facial nerve back in here. Okay? So here's the main trunk of the facial nerve. The next step is to revisit and just take a little more detailed look at the facial artery and the facial vein. The facial artery enters the face by coming up over the mandible, the brim of the bottom edge of the mandible, actually here where you can get a pressure point. And then this is another artery which has a characteristic coiled appearance. You need the coil so if the mouth is opened, the artery would not be torn. And then it traverses this fat pad where it may or may not be cut. It gives off branches on either side of the oral cavity, and then it's just going to continue up. Here is the facial artery right here, and it's going to go up towards the corner of the eye. This artery is accompanied by a very important vein that we'll be discussing in more detail, and that is the facial vein. It has basically a parallel course coming up over the edge of the mandible, traversing this fat pad that you can see right here, and it also goes up towards the angle of the eye. And in fact, these vessels, as they approach the angle of the eye, change their names and are often referred to as the angular artery and vein as they come up towards the edge of the eye, so that you should dissect these out in some detail. Now, the next step is going to be to look at the sensory nerves of the face, and we're just going to show first a skull, and this is a good exercise because during your dissections you should have your skulls available so that you can look at some of the landmarks which are going to be important in the dissection. I've already mentioned palpation of the zygomatic arch, and now in looking at the three branches, sensory branches of the trigeminal nerve, once again, it's important to look at some of the landmarks. And starting down here in the mandible, we're going to look for the mandibular branch, or the mental branch of the mandibular division of the trigeminal nerve, right, coming out of this foramen right here in the mandible. And then just underneath the edge of the orbit, as I tilt this up, you can see this shadow right in here. This is another foramen from which the branch of the maxillary portion of the trigeminal nerve will be exiting, and we'll do this in our dissection. And then finally, there will be on the superior surface of the orbital brim right in here, there will be either a small notch or in fact a foramen that the supraorbital nerve will be coming out. We're going to look for each of these. To look for the mental branch, which comes out of this little mental foramen on the anterior surface of the mandible. And one of the easiest ways to do that is after you've approximated the site of the foramen is to reach your probe and run it along the bone until you find the aperture of that foramen, and usually you can come up with, as we have right here, a branch or the whole trunk of the mental nerve right here. Likewise, in looking for the infraorbital, so here is the orbit right in here, and we're going to look for this little foramen right here. I'm going to run my probe here. You can look for the inferior margin of the orbicularis oculi, and that's usually running along the brim of the orbit, so that if I push in here, I'd actually be pushing into the orbital cavity, and now right in here I'm going to be pushing into that bone. And if you run your probe in here, and you can see that the probe is now going into that infraorbital foramen, and if you simply do a sort of a scoop procedure, you will come up with the nerve right here. So here's the infraorbital nerve, which you can dissect out in a little more detail. Okay. In order to find the last of the sensory nerves, branch of the ophthalmic division of the trigeminal, once again, looking at your skull, approximate where the supraorbital notch or supraorbital foramen is. Once again, here is the brim. I can find the brim of the orbit right here. One way of doing it is just to separate some of the tissue, and you will be able to come up with the or a branch of the nerve shown right here. Okay, it's going to be running up on the forehead. And the other method for doing this is to take a scalpel, and I've already done this. I've cut all the way down to the bone, going down to the medial aspect of the orbit. Then I've cut across here so that I could get underneath and pick up all of the soft tissue and pull it forward. And in doing so, when you do that and you look on the undersurface, you will be able to pick up a number of small branches of the same nerve, the supraorbital nerve, as it courses up onto the orbit. And here's another branch right here, larger branch.